Hi, my name is Monet Nicole, and I am a birth photographer and doula based here in Denver, Colorado. I am also the co founder of Birth Becomes You, which is an international organization that shares birth photography and, more importantly, birth stories from around the world.
Yes, so my name is Alice Perjansky. I'm a documentary photographer based in New York City. I the first time I ever took photographs, I was 7 years old, and my parents gave me a little tiny, point and shoot camera to photograph my sister getting born. So I saw both of my younger siblings get born. They had hospital births with midwives, and ever since then, I've been really interested in birth, and I've been photographing birth for I think about 20 years.
Hi, I'm Tanya Lewis Lee. I am a writer, director, producer, the co-director, co-producer of the film Aftershock, and an advocate when it comes to women's health, specifically focusing on the disparities and inequities when it comes to women of color in the United States.
This work is important to me, obviously, because I'm in the birth space every week, every month. I work with families all across the Denver metro area, really all across Colorado. And I think it's incredibly important that we are finding ways to improve care and to center clients' experiences. For a lot of us, this is our job, this is our work. We see birth all the time. But for the families that we work with, this is honestly one of the most important days of their lives. And it is a day that often sets the foundation for that first year of parenthood and beyond. And so I know that as a birth worker myself, sometimes I forget how monumental these experiences are for these families. And so my goal and my job is to really center them as human beings that are going through a really significant life event, and to always highlight their unique background, their unique desires, and their unique choices, because we're all going to approach this life event in different ways based on our values and based on our families.
It's really important to me to share these photographs in a very accessible way, meaning in newspapers and magazines that have really wide circulation, so that people get to see that there are possibilities for evidence-based, culturally focused, respectful birth experiences in a variety of settings. I think we all know the statistics in the United States, particularly for Black and Indigenous birthing people. And so it's really important for me to be able to photograph the people who are at the forefront of advocating for this kind of change. So I often end up photographing in birth birth centers that are run by Black providers, or photographing in hospitals or doulas, people that are providing those kind of birth experiences to people who wouldn't otherwise have access to it.
My work as co-director and co-producer of the documentary film Aftershock really highlights the experiences or the lived experiences of people who have gone through the loss of a loved one due to childbirth complications. It was really important for me to tell this story of the United States maternal mortality crisis through lived experiences. I think often we hear about the statistics, the numbers, but what we really wanted to do with the film was to humanize the issue so that people understand that when a woman dies from childbirth complications, her family is left devastated. Her children, her partner, her extended family, and her community. So it was really critical to follow the lived experiences of people through the film, and at the same time highlight the expertise of those who are on the front lines of the maternal mortality crisis, doctors, OB-GYNs, as well as midwives and doulas.
I think that, I spoke about values, and I think that's something that can get forgotten. I think that, as healthcare providers, we're often looking at, risks versus benefits. And I think those conversations are really important to always be having. And informed consent is obviously the foundation of good healthcare. But sometimes I think that we forget that every family comes to their birth with a unique set of values. And it's not just a medical experience for them. It's not just about, did I have a quote unquote safe birth? For most birthing people that I work with, this experience is spiritual, it's emotional. It's not just this physical bodily health experience. And so I think by centering their story, we can not only provide better healthcare, but I think we can provide a better experience that translates longer than just their birth.
So I have definitely seen that the people who are receiving the kind of care, evidence-based, culturally focused, respectful, in my experience photographing, typically midwifery provided, although not exclusively, care, continuous labor support, a lot of the stuff that you all are providing and advocating for, that has led to better outcomes in these facilities, fewer low birth weight babies. I could go on and on, but it's important to me to show the visual aspect of this stuff, but also to know the background that what I'm seeing, what it means. So a lot of photographs that we see of birth, or even media representations of birth, I'm including the movies, I'm including, reality TV shows. It's a very disempowered experience. It's a woman, it's always she, is lying down flat on her back, being wheeled somewhere, screaming, maybe screaming at her husband, "You did this to me!" And then a doctor comes in and delivers her baby and takes it out of her. And so even in the reality shows that I've seen about this, there's not that experience of the person advocating for what they need or receiving support. And it's a lot scarier and more violent than what a birth often looks like, even a really difficult birth.
Well, I think centering the birthing person is paramount to better birth outcomes. I think when we give the power back to women, we allow women, for those of us who choose to birth, to really understand our power. I believe we need a cultural shift in the way that we talk about birthing across the board, reminding us all that birthing people are powerful. Part of going through the experience, I don't want women to suffer. I think we worry too much about pain. We're too afraid of the pain, and maybe that's something we need to experience to some extent in aftershock. We do show an amazing birth. We were very fortunate to catch. And as Felicia, the young woman who gives birth in the film, says, it's the hardest thing she's ever done. But at the same time, after birthing that baby, doing the hardest thing she's ever done, she knows she can do anything to protect that baby. So I think when we center birthing people, we give them the power to choose how they want to birth, if they want to birth in a hospital, if they want to birth in a birthing center, if they want to birth at home, with whom they birth, what the team looks like, and what that experience is going to be. And when a birthing person is able to have that kind of structure that she has created around her, she's able to let down and feel safe and centered and be able to drop into that space she needs to in order to bring this life here.
So it's really important to me in my photographs to show those relationships between the provider and the person who's giving birth, and the person who's giving birth and their support people, and just to show it from their perspective, to show what it feels like. And I'm not trying to, I'm a documentary photographer, I'm a photojournalist. I'm not trying to act as if birth is easy. I'm not trying to make it something that seems perfectible, like there's a right way to do it, or like it's without deep and intense struggle, and at times risk, and at times intense pain. But it's important to me to just show what I see. And I think that I really strongly believe that in seeing that, people are less afraid of the experience and able to make choices for themselves. I think that our culture really lacks coherent narratives around birth. I think a lot of other cultures have narratives that help people understand who should be in the room, what it means, how to categorize it. Is it spiritual? Is it medical? Is it transformative? And people have often seen other people in their families give birth. But I think here we don't really, in the mainstream cultures that I'm part of, we don't have these narratives. And so I think that it makes a lot of people not really consider what birth means until they're pregnant. And because we don't really know what category to put it in, we sort of are like, I guess it's just medical and therefore scary, and therefore I need somebody else to make all of the decisions for me, instead of this idea that you could work with your provider to learn from them and to make choices together about your care.
I have many clients that went into maybe their first birth and they didn't feel seen. Maybe they experienced birth trauma, and that not only impacts that birth experience, but I see it impact the whole family system. I see hesitancy to bring their kids to the pediatrician. I see them express fear about getting pregnant again. I see them make choices on their next pregnancy or birth based on trauma that they experienced with that first birth. And so it really does have this ripple effect that goes way beyond. I hear a lot of providers, and nurses and doctors say at the end of the day, all that matters is a healthy mom and a healthy baby. And yes, I think everybody agrees with that, but we have to look at health more than just being alive. It's about, are they mentally healthy? Are they leaving the hospital feeling supported? Because so often I see moms and birthing people struggle in the weeks and the months and the years that follow because of something that happens on their birth. And so I think that, the more that we can center their experience, the more we can really listen to what they want. Even if we don't necessarily agree, our values are not their values necessarily. And that's okay. As long as we're presenting them with options and choices, I think at the end of the day, if we can really respect them and treat them as whole people, that's going to make a big difference in how they perceive their birth, and then how healthcare continues long after they leave the hospital or the birthing center.
Health equity to me means that all people, regardless of station of life, have an opportunity to get the best care possible, to get the best preventative care possible. I don't mean just crisis care. I mean preventative care, overall care. And I really believe it's possible. And I believe that all people should be allowed to choose how they, and specifically around childbirthing, I think should be able to choose their outcomes, or rather, all people should be able to choose how they want to birth, and to be able to do so in a safe and dignified manner.
Patient equity means to me that the patients are treated with respect, and that a provider understands the cultural context in which they're working, that they ask good open-ended questions, that they listen. I know how hard it is for you all working within these complex systems. I can only imagine the pressures that are put on people, everything from insurance to, there is so much that makes that really challenging to do. But people that are able to bring that feeling of empathy and respect with all of their medical knowledge combined together, it's really, you know it when you see it. Because our culture lacks the sort of birthing stories that would help us do that and help us integrate it into our understanding and therefore feel empowered to make choices about it, I think I went out and found my own stories because I really needed them. I've seen some really beautiful births, and I've been really lucky to see them and to see a lot of support provided to people who are broadly, face a lot of institutional racism throughout the culture, who are receiving, again, I keep coming back to this, but evidence-based, culturally focused, respectful care. And it's really profound to be in that room, and it's a huge privilege. It's also when providers are able to both rely on their immense expertise and also to have the humility to learn new things. That's something that happens to me a lot as a journalist, where I do know a lot about the situation. I have to, in my mind, I have seen a lot of people get born, but I'm not a healthcare provider. Like, I've seen it, but I would never be able to catch a baby safely, well, maybe I would, I don't know. But I think the difference is it's understanding which things you know really deeply, and then which things you have seen a lot of but don't fully understand, and then which things you need to ask an open question about. And so it's going into it with a humility and an openness to new forms of knowledge and to understanding new things. It's like something that I have to think about when I'm working in cultures that aren't my own, or in settings that aren't my own, or seeing something I don't understand. Trying not to be worried about sounding dumb. It's something that I really hate, but there are times when I'll have to ask someone to explain something to me, or just to listen.
I think a lot of the stories that we see on social media are from folks that have a lot of access to resources, that have large social media platforms, that have the ability to share their stories and have access to all kinds of layers of support. I don't think we do a good job in this country of listening to voices of people that maybe don't have that level of access or that affluence. I think that young patients, I often see young patients get discounted because of their age. I think about incarcerated pregnant people. I think those folks deserve a platform. The way that they are treated during birth in many places is absolutely, I think, horrific, and I think it's inhumane. And so I think that there is so much room for us to find ways to really listen to these stories. And again, it's not about did they have a safe vaginal delivery and go home with their baby. It's not as simple as checking off that box. It's can we find a way to sit down with them and ask, okay, what about your experience made you feel seen? What about your experience made you feel heard? Not as another patient on the scrub board, but as somebody who is an individual that has individual needs, has individual, values, and has their own unique story. I would love to find a way for this to be common practice at hospitals all across the state, where we're talking to people, not just about, again, the safety and the health aspect, but the spiritual, emotional aspect of giving birth. And if we're not doing that, I do think that's a big reason we are seeing so many people deciding to give birth outside of the system, is because they don't feel like their unique background and their unique individuality as a human being is recognized in the hospital space.
The stories that aren't being told in my field are, again, just these stories of birth in all its complexity and beauty and intensity. We see it as a dangerous thing. We see it as a gross thing, as something frightening, and we often see it attached to really horrific statistics. So yes, of course, we need to hear those stories, but it ends up adding to this narrative where birth is scary and dangerous, and you don't have the expertise to make decisions, and you better put it in someone else's hands. Best not to know anything about it. I think somebody can come through a journey and decide, I feel most comfortable giving birth in a hospital with an OBGYN. I would like an epidural the first second that I can, and I would like to formula feed my baby. That in no way means that this person is not having an empowered birth experience or hasn't thought through the options. They have come to this choice. I kind of don't care which choice they're making, as long as it's safe, as long as it really feels like this person has been able to make this choice for themselves. So that's a big kind of response that I get from people sometimes, is people worrying that, there is this pressure to have the perfect birth. And I think that position, I understand that. I certainly feel feel for people who had wanted something very particular and are experiencing a lot of grief and loss over not having been able to give birth in that way. However, that's a conversation that I try to avoid in regards to my work, because that's not what my work is about. My work is not about a person who is privileged to have a lot of access and feels this perfectionist pressure from outside. That's not what it's about. It's about this movement of care providers, particularly care providers of color, who are advocating for safer, healthier, more respectful births for people who wouldn't otherwise have access to it.
So the storytelling piece is really critical, because what I have heard, witnessed, and experienced is that many times birthing people are not heard, they're not listened to, they're not seen. And I think it's really important that storytelling, sharing one's experiences, is critical so that people understand. And I say this to say that I understand the system in which many healthcare providers operate in. You have to move quickly. You don't have time to spend with people. You're looking for a crisis. You're trained. If you're trained as a doctor, that is your job. You're looking for a problem. If there's not a problem, then what are you complaining to me about? And I think that it's really important for healthcare providers to be able to take a step back and from the system in which they're in, and remember that we're dealing with human beings. And that's why, to me, the storytelling is so important, going back to humanizing people by storytelling, so that healthcare providers can be reminded that in order to provide the best care possible, understanding that you're coming into a space with your own biases, your own life experiences, so very different often from the people that you're caring for, and understanding that their experiences can be so vast and so different, and recognize that you are dealing with a full human, not just a human who has a baby inside of her that you need to get out, but someone who's going to be taking care of this infant, who's taken care of this infant up until this point, who's been growing inside of them and really needs the support thereafter.
I mean, there are a couple, I could tell birth stories all day long. One that was really beautiful is, I'm originally from a small town in Western Massachusetts called Greenfield, Massachusetts. And it's a beautiful rural town, but it also it's a post-industrial New England town and has a really big issue with substance use disorder. And so there's a program there that doulas who are in recovery are working as doulas for pregnant people in recovery. So they start working with them when they're pregnant, and then they continue working with them for a period of time after they give birth. Nobody who was participating in the program gave birth while I was there. However, I was photographing in the hospital where my siblings were born. And there was a pregnant midwife. And she, while I was there, coincidentally, was like, I need to ask my colleague to give me a cervical check, because I think that I may be in labor. And she was, and I got to photograph her birth, and her birth was attended by her colleagues, and it was incredibly beautiful and powerful. And it was really amazing to see her shift from being in the provider role to being in the birthing person role, and just to go through this experience supported by her colleagues. It was really pretty amazing to watch.
I think that so often healthcare providers have a really myopic view of what a successful birth is, right? And in their minds, someone comes in, they have an uncomplicated vaginal delivery, or they have an uncomplicated cesarean birth. Mom and baby are both healthy. They go home and they think, okay, great, this was perfect, right? Or not perfect, but this was, we did our job. But as a birth worker and as a birth photographer and as a doula, talking to these families, sometimes, and not often, but I would say a surprising amount of times, you talk to these people and on paper they had a very straightforward birth, but the reality is that the things that happened to them during their birth, whether they were treated, the choices they had or the choices they didn't have, the words that were spoken by healthcare providers, all of these things can add up and turn what seems like a very straightforward, healthy, normal birth into an experience that was frankly really traumatic and violating for families. And so I think it's really important as providers to listen and to hear stories that maybe challenge what you may have thought about that birth, or maybe challenge what you think about a certain situation.
You know, in Aftershock, we followed two fathers and a few others that we've met along the way as they were picking up the pieces of their lives after their loved one passed away from preventable childbirth complications. I think, and many people were really surprised, like, oh, we weren't expecting, you're talking about maternal mortality, we weren't expecting a film to focus on the men, but why wouldn't we focus on the men? They're the ones who are left behind. I think that there is a misconception when we talk about women's health, when we talk about maternal health, that it relates just to the mother. The mother is the center of a home. And so, of course, we would cover the men. I think there's a whole story about the children who are left behind. I mean, the women who we covered passed away soon after their children were born, so we're following them immediately. But what happens 10, 15, 20, 30 years down the line for people who've grown up, whose mothers have passed away from preventable childbirth complications? Birthing takes time. It's a process. It's something not to be rushed for the convenience of the doctor or healthcare provider or health system or even the parents. It's something to be, I think, really respected. Again, if we allow that time, we see that the outcomes are better.
I think that when patients feel like the people in the room are invested in not only their health, but also this kind of bigger part of their family story, it can make a really, really huge difference in their ability to trust the recommendations that you're making and their ability to listen to what you're saying and not get defensive. If they feel like you really see them and not just like, I'm coming in, I have 5 minutes, I've got to run through really quickly our options here. I think that can make a really big difference in how they perceive their experience and in what choices they end up making for their birth and their baby.
I mean, you're doing service work, and understand that you're in service of the people that you care for. So you need to meet them where they are, and you need to suspend judgment of who they are, who you think they may be, because you never know who you're dealing with, what they're experiencing in life. What I've come to realize is that we're all going through something in some way, shape, or form in our lives. And it's a privilege that you have to be able to be in service of these people. And yes, you're providing important care, but that is a service. And when you look at it that way, I think maybe you can approach the people you care for with a little more compassion, a little more grace, and a little more humanity. I feel like where we are right now, I feel like we've lost a lot in terms of just humanity and understanding the human experience that we each are going through. And so often we're so siloed and we forget that to be human is something that we're all experiencing, whether you have brown skin, white skin, you're gay, you're straight, whatever it is, you're still a human being. And I think we need to find the universal the universal elements that we're all dealing with and focus on that, as opposed to what we think is so unique and different about one another.
I'm very grateful that you've chosen to do this work. It's incredibly difficult. It's exhausting. And I think seeing this from the outside, I get to think about it all the time, but you're actually in it. And so I just really appreciate the intention you're bringing to these, multitude of individual minute interactions that are very easy for me to critique broadly in a cultural setting, but which you're bringing so much intention and thought to on a daily basis. I appreciate you working on this. I think your work is incredibly important. I think birth it does fit into many categories. Medical, for some people, it can mean something spiritual, personal, cultural. It's a very complex experience in people's lives, and I really appreciate you making it something that is a profound experience that feels empowered and full of its difficult beauty.
So just be really thoughtful and how you practice. Remember, the power is in the person who is birthing, and that you are there to be of assistance and to keep her safe.
The main thing that I've taken away from this is that birth is to be given great respect, and anybody who violates that is really violating something very profound. And that kind of birth can take place in many, many settings. And the main thing that I've found is that people feeling like they have a say and an understanding in what's happening really changes the way they experience it. Whether they were in a birth center and had a hospital transfer, or had an unplanned cesarean, and it wasn't what they wanted. They were really hoping for a vaginal birth. The main thing that I've found is that people feeling respected and feeling like a part of their care have that sense afterwards of having done something really powerful.
I mean, I think I would just reiterate that, we do this day in, day out, but for these families, this is truly a monumental event that not only affects them when they're in the hospital, but will affect their willingness and ability to seek medical care for years and years to come. I see this as a generational issue. I had a client just the other day, and I met with her and her mother, and it was amazing for me to watch. We were talking about her daughter's birth, but the mother went back to her own birth experiences and the things that were said and done to her. And I knew that those experiences were now impacting the choices that this daughter was going to make. So it's not just this one day, it truly can have this generational effect. And I think that's a public health issue. Mothers are often the healthcare decision makers, not only for their children, but for their partners. And so if they go into a birth experience and they are treated in a way that makes them feel less than human, or makes them feel like they aren't seen or heard or respected, it will absolutely impact that whole family's health future in ways that we can't fully measure. But as someone that works with these families, I see it happening, and it is astounding. And so I would say, realize that these days are hugely important. And the more that you can take the time to connect with your patients, to really get to know them, to talk about their values and respect those values, even if they're different than perhaps what you would want or what you would choose, will make a huge difference.